And how are COVID cases trending at the minute? Are there any concerns, given how much pressure the NHS is under right now, that a further spike in cases will really lead to the NHS being in an extremely difficult situation over the winter?
Yeah, so we keep a regular eye, as you'd imagine, on the ONS data, that weekly data that comes out, and we'll get obviously a further update tomorrow on that. But you'll have seen from the last few weeks, in fact even the last couple of months, we've been trending at kind of relatively high rates of COVID, and then we've seen dips and then a kind of oscillating plateau of cases of COVID. So we're keeping a really close eye on COVID cases, far higher than I would like it to be, but hence why the vaccination is so important as a real game changer. So yes, we're still vigilant on COVID. I think COVID, flu, respiratory viruses affecting children and adults, the weather, we know that the weather can precipitate slips, trips and falls, for example. All of this combined is going to put quite significant stress on an NHS that is already under severe pressure. So we're doing everything we possibly can to support our National Health Service through what will be probably, I suspect, the most challenging winter it's ever faced.
I know the NHS in England is having a lot of problems at the minute with flu, just normal flu, especially among children and mothers and so on. What sort of precautions are you taking around this? How can people better protect themselves against that?
So a few things. They can get vaccinated if they're eligible. Really important you do that. And we've decided in Scotland to co-administer the flu vaccine with the COVID vaccine. That's not been replicated necessarily in every part of the UK. So really important that you do come forward, and we think that's why we've got really good high rates of uptake for the flu vaccination. So that's the number one thing you can do. Practice good hygiene. We know that from the last 2.5 years. We know what good hygiene measures look like. Really important you do that, and really important that if you are unwell, then you consider that good public health advice that we've been practicing for the last 2.5 years. But look, we're also seeing, we know, rises in flu cases here in Scotland and other respiratory infections that are affecting both adults and children. So whatever we do, we know that this winter will be very pressured for the health service.
How big is that rise?
So we're still at moderate levels, but there will be, we have seen increases. But other respiratory viruses too, for example, there's been a lot of media coverage, we know, of strep A, and it's a mild illness in the vast majority of cases. But there's no doubt from my clinicians that we're likely to see an increase in those cases over the next few weeks. So it's not just about flu. Flu is important. COVID is important. There's a whole multitude at this time of year of respiratory viruses and illnesses that are coming back with a bit of a vengeance, because we didn't have them in the last couple of years given the legal restrictions that were in place at that time.
Thanks very much.